Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing you another really wonderful guest today involved in creating a better tomorrow for everybody out there. Today, we have the honor of being joined by Dr. Peter Singer, who is Special Advisor to the Director General, Dr. Tedros Ghebreyesus of the World Health Organization, where he helps support the Director General, ultimately with their focus on transforming the WHO into an organization that is sharply focused on impact at the country level. Dr. Singer co-chaired the transition team at WHO. He was the architect of their strategy and their triple billion target, which is a focus on 1 billion more people around the world benefiting from universal health coverage, better protected from health emergencies, and ultimately enjoying better health and well-being. And he supported a strategy implementation plan across WHO's budget, their framework, their investment case, their innovation frameworks, ultimately all through multilateral partnerships that ultimately help address United Nations Sustainable Development Goal 3 in the Global Action Plan, which is focused on good health and well-being. And during the pandemic, he's also been an extremely passionate and vocal advocate about vaccine equity. Before joining WHO, Dr. Singer co-founded two very important, innovative, results-driven social impact organizations. Dr. Singer was the Chief Executive Officer of Grand Challenges Canada, a Canadian nonprofit that ultimately uses the Grand Challenge model, requiring coordinated, collaborative, and collective efforts to fund solutions to critical health and development challenges in the developing world. And during that period, they raised close to $500 million to support over 1,000 innovations in more than 90 countries around the world, saving millions of lives. He also served as the Sun Life Financial Chair and Director of the University of Toronto Joint Center for Bioethics, where he is also serving as adjunct professor of medicine at the University of Toronto. Dr. Singer got his master's in public health from Yale, the medical degree from the University of Toronto. You can also pick up his book, The Grandest Challenge, Taking Life-Saving Science from Lab to Village, published in 2013. We are honored to have him. A lot of really interesting topics to talk about today. Dr. Peter Singer, welcome to our show.
Thank you so much, Ira. It's great to be with you and your viewers and listeners.
Peter, it's great having you. I would love to start off with a focus on the Grand Challenges story. Obviously, you were so instrumental in creating this organization, everything that it's about. If you could take us just a little into the history of it, the background, and if you could also educate us a bit on the Grand Challenge model, because one thing we've been hearing a lot about lately, last couple of years, is the topic of the moonshot, which when I sort of look at the definitions of both, somewhat similar goals, but a little different sort of implementation pattern there. Talk a little bit about that as well, if you would.
Yeah, thank you, Ira. So the Grand Challenges model is really a way to stimulate innovation with impact on important societal challenges. And it's as simple as that. The history actually goes back 100 years to David Hilbert and Grand Challenges in mathematics that kept mathematicians going for a long time. Then in 2003, almost 100 years later, the Gates Foundation applied the model to global health, which is super important because at that time, there wasn't that much science in global health. And so that's really the significance of it. It's bringing in cutting edge science and cutting edge innovation into the area of global health. I got involved really by serendipity, almost like, Louis Pasteur, chance favors the prepared mind. We were working in 2001, 2002 on the role of science in global health and global development. We just published a piece called Top 10 Biotechnologies in Global Health. And in late 2002, I got a call from the person that was leading health at the Gates Foundation at the time saying, could you meet us in Washington in January? I'd been working very closely with my friend and colleague, Abdullah Dar. I showed up in January. They said, Bill Gates is thinking about putting a couple $100 million into this Grand Challenges thing. Can you explain to us what you did? So I did. Obviously, the PowerPoint didn't work in that meeting, which I found fun. And that's the point at which, shortly after that, the Grand Challenges were announced. Harold Varmus, the Nobel laureate, was there. Elias Zerhouni, who was running NIH at the time. And then in 2003, pulled together a scientific board. They did and launched, identified the top Grand Challenges that kept people going busy for a while. And now, almost 20 years later, there's been some amazing progress. Just to pick up one concrete example, one of the challenges was about modifying vectors so they don't transmit disease. You've now got a project led by Scott O'Neill, the World Mosquito Program, that's put something called Wolbachia, a small intracellular parasite, into mosquitoes so they don't transmit dengue. And you actually see dengue rates dropping in many communities around the world. Just one example of using cutting edge science. I'll pause there, Ira. We're only up to 2003, really, although I did the foreshadowing. And then from there, if you wish, I can go on and describe how that concept broadened out and led to Grand Challenges Canada, and then ultimately from there.
Absolutely, and I'm going to enjoy a little later on. We'll talk about the Wolbachia story per the not just sort of a developing country biomedical interventions, but this concept that you've talked about in terms of civil society organizations getting involved in the process. Yes. One place I'd like to go, and you could go in any direction with this. And if I'm jumping around, that's fine. You can reorder me. But you gave a presentation on the history of Grand Challenge. This is about, I think, 7 or so years ago. It was a presentation you gave at University of Waterloo, Center for Bioengineering and Biotechnology. And in this presentation, you were talking about sort of the three parts. We need to plan the challenge, we need to fund it, and we need the proper innovation. And you gave some really interesting examples of how, that innovation might not have to be the highest tech, and we might not have to spend the billions of dollars. And you gave 3 really interesting examples. One that had to do with leishmaniasis, a really cheap leishmaniasis test, and amphotericin B. You talked about chlorhexidine in Nepal, sterilizing umbilical cords to prevent disease transmission. And then there was this other cool story you talked about, epilepsy patients in Haiti, where you had sort of healthcare workers and faith-based organizations trying to tell people, these are not zombies and possession, but, some phenytoin, I guess. Some low-cost epilepsy treatment would be perfect. Talk a little bit about sort of this intersection of the challenge, the funding, and the proper, what you term social innovations in this presentation.
Yeah, sure. And it goes to the issue of what is innovation and right. How do you define it? It can be health products, as we saw with the mRNA vaccine in COVID. It can be social or service delivery innovations. And your example of chlorhexidine in Nepal, where you put a little antiseptic on the umbilical cord of a baby instead of dirt, which was the cultural practice, and decreasing newborn mortality rate that way, which is what happened in Nepal and many other countries. That's almost an example of a service delivery or a social innovation, right. Or it can even be financial innovation. I think a really good example of this is the Friendship Bench in Zimbabwe. If you have a mental health condition if you have a mental health condition and you take a global figure, you probably have less than a 1 in 10 chance of actually having treatment for that condition. And by the way, we did go on and do grand challenges in mental health, grand challenges in non-communicable disease after the story I mentioned, because mental health is the main burden of disease, and non-communicable disease like heart disease and cancer causes 70% of all deaths in the world. So anyway, going back to this example of the friendship bench, this was culturally adapted cognitive behavioral therapy for mild to moderate depression and anxiety on a park bench given by grandmothers who'd been trained in this great social enterprise by one of the relatively few psychiatrists in Zimbabwe, Dixon Chibanda. So this social innovation, this delivery innovation was needed because there weren't enough psychiatrists to cover the mental health needs of Zimbabwe. So this was community health workers, essentially, these grandmothers. We funded a randomized trial in Grand Challenges Canada through Grand Challenges Canada that showed very significant benefits and then assisted in the rollout of this. This has now reached 94,000 people as of last year. And the idea is to get to 200,000 by next year. Of course, the issue is you need millions of people to move the needle on the SDGs. And so that's one of the fundamental limitations of innovation, which is scale. But your original question was the breadth of innovation. So it can be a health product like an mRNA vaccine. It can be a grandmother who's trained to give, essentially talk therapy on a park bench. And what's super interesting about that comparison is if you take the baseball analogy, with mRNA or with other high technology things, you're hitting home runs. Right. And home runs are great. But with the friendship bench and other social innovations, chlorhexidine, you're hitting doubles and triples. And if you hit enough doubles and triples, you can save a lot of lives. And so incremental innovations, I think, in the aggregate are just as important as these breakthrough innovations. And to your original introduction, maybe that's one of the differences between the Grand Challenges model and the moonshot, which is much more focused on these breakthroughs. We really need both.
Yeah, and that's an excellent segue into sort of the next talking point, because offline you and I chatted per this really interesting paper you wrote about 20 years ago, over 20 years ago now, Nature Genetics, entitled "The Top 10 Biotechnologies for Improving Health in Developing Countries," and you assess a variety of criteria in terms of the burden, feasibility, the knowledge gap, various other issues. And Peter, you come up with, you must have had a crystal ball, because basically everything you came up with it's like you wrote this yesterday in terms of, bioinformatics tools to examine pathogen host interactions and unique, low-cost sequencing technologies. Talk about what was going on in October 2002 when you wrote this paper, because I think this is an important stepping stone to some other things we'll be getting into.
Yeah, thank you. What was going on was, people had talked generally about the application of genomics and biotechnology to global health, but we reasoned that the concrete examples and applications would really drive things. So this was, in a sense, David Letterman does global health. It was a Delphi, David Letterman's top 10 was a Delphi consensus building study of the top biotechnologies. It did actually lead to the engagement with the Gates Grand Challenges. One of the questions I was asked in that meeting in January in Washington in the small unmarked Gates Foundation office, I think by Harold Varmus, was, Peter, if you had to do it over again, he was talking about the top 10 biotechnologies you just mentioned, study, what would you have done differently? And I chuckled and I said, I would have put $200 million behind the list, which is exactly what the Grand Challenges in global health did. But to your point, it was kind of prescient. The top one there was molecular diagnostics. Yep. Think about all the PCR and rapid antigen tests that were used in COVID. Yep. The second one was recombinant vaccines. Technically, the Ebola vaccine is a recombinant vaccine. One of the COVID vaccines is a recombinant vaccine. And I guess, it's a little bit of a stretch of the word recombinant to get to the mRNA vaccine, but still these sort of biotechnologically enhanced vaccines was the second one. And the third one was drug and vaccine delivery. And just think about the current search for a universal flu vaccine or a universal coronavirus vaccine, and in particular, the nasal administration of that. So you get the mucosal immunity. That's a drug and vaccine delivery issue, especially the nasal delivery more than the universality, I should say. So those were the three things. And yes, they're still as relevant as today. But the goal there was really to concretize what was meant by genomics and biotechnology and global health, and put us on a prioritized path to identify and fund things. And that's what was actually happening in the Gates Grand Challenges, and then subsequently in Grand Challenges Canada, and then a network of Grand Challenge organizations around the world.
And this then leads into, a variety of your publications on some of the different grand challenges in the ensuing years. And, one of the items is in the top 10 is, of course, technologies for environmental improvement. And in 2007, at PLS Medicine, you publish grand challenges in global health, engaging civil society organizations and biomedical research in developing countries, sort of, defining, what these CSOs are. And so, we're doing more than research here. We need to provide services and advocacy and think about the community. Talk a little bit about CSOs, if you would, and then I'd love to now swing back. Wolbachia is a great story. You got this bacteria that loves killing mosquitoes, which bring us all sorts of problems. Talk a little bit about Wolbachia and the connection to the CSO model, if you would.
What was super clear was that science and ethics and community engagement need to go hand in hand if you want to bring breakthrough technology to life. And that's the Wolbachia story. Imagine you can't just go out and put a bunch of small intracellular parasites into the mosquitoes living in someone's backyard, right, without talking to them. And so, the investigator, Scott O'Neill, did a lot of work engaging the communities with whom he was working. That's why it's actually taken 20 years, and rightfully so. He had support to do that as well, because the Grand Challenges program did support an ethical, legal, social team. But Scott did a fantastic job doing it. It's a great example of a technology that needs to go along with the ethics, with the community engagement. I first learned this lesson when I was doing my fellowship in bioethics. It was going to be, now we're back in 1987. The University of Chicago was about to introduce the world's first live donor liver transplant. Mm-hmm. And I was working with Mark Siegler at the time and with the transplant team. And we quickly realized that, if they just did it, and then the next day it was on the front page of the New York Times, there'd be a huge backlash. So what we actually did was an ethical analysis of live donor liver transplant, where you're putting a healthy person at risk in donating their liver, but for the benefit of a related person, an unrelated person. We went through that whole analysis, published the ethical analysis in the New England Journal before the transplant was actually done. So there was another example, and that's where I learned the lesson of the need for the ethical analysis and also the community engagement that went along with publishing that to go hand in hand with the science. Another example, in addition to the Wolbachia. And
continuing along that same year, you also publish in November 2007, the Grand Challenges in Chronic Non-Communicable Diseases. And, here you point out again, this is a major population, major part of the world that responsible for death. And, while I'm not, I don't run into malaria or leishmaniasis or anything like that, obviously heart disease, cancer, diabetes, these diseases are everywhere and growing. It's interesting because at the time, obviously one of the line items in the original report was, as you were just mentioning, the recombinants, and a lot of things can fall in there. But, we've seen obviously the explosion in mRNA technologies. Immuno-oncology has gone crazy as a segment, making really important impact. Talk a little bit about what you would like to see per some of these non-communicable diseases, because this is clearly a major health burden. We spend trillions here in the United States alone on this stuff. we have some challenges, some grand challenges in areas like healthy aging. National Academies of Medicine, UK has one as well. It sort of encompasses a basket of chronic degenerative diseases. What do you want to see in this space as we're in 2023 now, looking out a little bit?
The starting point is that 70% of deaths in the world are caused by non-communicable disease, heart disease, cancer, lung disease, and so on. And so there's a huge amount of lives that you can save and premature deaths that you can save. We've seen this through smoking, efforts to curb smoking, where you've had a significant decline over the years. But to take one concrete example, think about hypertension. Most hypertension is either unrecognized, untreated, often leads to stroke and heart attack. If you could actually treat all the hypertension in the world, you would save a ton of lives alongside the smoking, alongside a few other things. And so that's an example of what I'd like to see. And you can do that with very focused innovations, data and delivery, and a focus on hypertension. People don't focus on hypertension in global health. And yet it accounts for a ton, or as much as it merits in terms of its epidemiological significance. And you could save a ton of lives just by treatment of hypertension. That was the kind of stuff that was in that grand challenge. And indeed, that led to the formation of an organization called the Global Alliance for Chronic Disease in the UK that's issued some requests for proposals for innovation on hypertension and on diabetes, for example. And then all that led us to the Grand Challenges Canada, which was I was super privileged to co-found. And that was a story of sitting in my office after having done the things we've just discussed in terms of the other grand challenges and so on, and getting a phone call in February 2008, the day of the Canadian federal budget, from an official in the Department of Finance. And they said, "We've been reading your editorials." I'd been writing about the grand challenges model, et cetera. And it turned out that there was, at that point, 50 million, ultimately 200 million in the federal budget. And that led to the launch of Grand Challenges Canada in 2010, which, as you said, has supported now 1,400 innovations in more than 90 countries, leading to very significant outcomes. And Grand Challenges Canada was a bit unique in the sense that we supported mostly innovators in low and middle income countries themselves. 2/3 of the money went there, a reasoning that people closest to the problem were best situated to solve it. We also had a predilection for supporting social and service delivery innovations. We put a lot of money into mental health. We put a lot of money into early child development, among other things. And so that's important today, because what you see, for example, in COVID is that those countries that innovated themselves, for example, made their own vaccines. Now I'm switching back to health product innovation.
Sure.
Were the ones that had higher immunization rates. And so science and innovation is actually a way to help countries on the path to self-reliance, right, which is ultimately what's needed in global health. Some people call this decolonizing global health, but it's actually the self-reliance that you need. Science and innovation is a path to do that. That's how countries become prosperous. That's how you have jobs. And it's also how you solve your own problems. So take us right up to this week. Dr. Tedros was in South Africa at the mRNA Technology Transfer Hub, which is an effort to share technology and know-how on mRNA vaccines, applied initially to COVID, but then extended to HIV, tuberculosis, et cetera, in the future, with countries throughout low and middle income countries. There's 14 spokes, if you will, now related to that thing. And so it's a great example of countries becoming self-reliant through science and innovation. And it's the same thing that's at the heart of Grand Challenges Canada as well, which is a bit different than the original Grand Challenges in global health, where most of the innovators that were initially funded were from Harvard and Stanford and Oxford, and nothing wrong with that. But if you really want sustainability, if you will, of impact, you really need to support innovation in countries themselves, because talent is global, opportunity is not. And that was a unique feature of Grand Challenges Canada that we all feel proud of.
Outstanding. Nature 2011 July, Grand Challenges in Global Mental Health. And this is, as you were saying at the beginning, this is a big one, because it's not just the what defined in the paper, mental, neurological, and substance use disorders, but obviously mental health connected to a lot more than just the central nervous system, and we know sort of the integrated connection to everything that goes on up here everywhere else. And you point out in this paper, obviously, you were sort of taking a whole of life view on this, studying everything from sort of the early relationships between fetal and early childhood development, something that you define as resilience issues in areas of extreme social disadvantage, which probably many of us never experienced, but obviously in your travels you've seen and you study. Talk about the greater social determinants context here, because it's a big basket, right? I mean, this is not a little thing, and it has many tentacles beyond sort of, hey, here's a gene for X, and we'll target that. A much bigger burden here. Talk a little bit about your thoughts on mental health grand challenges, if you would.
Yeah. I mean, maybe I'll start here, Ira. If you were an evil scientist and you wanted to make sure that poor countries stayed poor, all you'd need to do is make sure that the brains of children that are born in that country don't develop in the first 1,000 days of life, and even in the prenatal period. And that's actually roughly what's happening because of threats from nutrition, threats from parenting and learning, early learning, or lack of parenting, and threats from violence, for example, and also toxins. So there's a wide range of reasons why children's brains don't develop, and that early child development is so important in future productivity of those children, and even decreasing violence. So that's a good example of a social determinant of health. More generally, there's about 50 health-related sustainable development goal targets out of 170 something targets in total. And of those 50 that are related to health, about 2/3 are in SDG 3, which is on good health and well-being. But 1/3 are in other SDGs. So think about things like climate and air pollution and the deaths that causes, water and sanitation and the deaths and illness that causes, nutrition, the same types of things. So those are the social determinants. And in fact, fast forward to WHO, one of the things that Dr. Tedros did was he actually created a division of healthier populations to deal with the social determinants of health. More tactically, what that paper led to immediately, almost within a month, is the launch of a program for one of the challenges in there on mental health service delivery, where Grand Challenges Canada put $50 million or more ultimately into mental health innovation in low and middle income countries, becoming one of the largest donors in that area, in addition to the U.S. National Institutes of Mental Health that actually led that Grand Challenges paper on mental health in Nature. So it was an issue in rounding out to social innovations, but also an issue in rounding out to social determinants, but also tackling some of the causes of ill health that weren't traditionally recognized as global health challenges, but were certainly plaguing people around the world. And that gets to a very significant issue of equity. Are we just going to focus on the diseases that are, let's say, 10 times as common in low and middle income countries compared to, or are we going to focus on the diseases that are most common in those countries? So are we going to focus on the differential, or are we going to focus on the problems that are actually being encountered. And actually, by we, I mean the people, the leadership of those countries themselves, because the only way for there to be sustainable change and sustainable innovation is with the support of national governments. And maybe I'll just end here on this point. That's what I've discovered at WHO, which is if you could only take the innovation pipelines of the Gates Grand Challenges, the Global Alliance for Chronic Disease, the Grand Challenges Canada, where the real problem is scaling and sustainability. It's easy to create a pipeline. It's hard to get it to scale.
Right.
You combine that with the country platform of 150 country offices from WHO with the social trust with the governments to integrate those innovations, or a very small subset of them, into the health systems of those countries. That's the way to speed up the Sustainable Development Goals. And that's actually what we need to do, because the Sustainable Development Goals are really lagging. They're going at about a quarter or a third of the pace needed to reach the agreed targets that governments agreed by 2030. So the question we should all be asking is, okay, in addition to our business as usual stuff, what do we really do to accelerate this by 2, 3, 4-fold? And innovation is one of the answers to that question, whether it's a breakthrough innovation like mRNA technologies, or whether it's a double and a triple, like improving service delivery for mental health through the friendship bench.
Mm-hmm. And one of those sort of, I guess, home run innovations back in, you wrote this piece in 2005 in Issues in Science and Technology. It was entitled "Harnessing Nanotechnology to Improve Global Equity." And here you were, as you were just saying, you were going through, hey, we have all of these countries that are eager to play a role in further developing this, and the global community's got to get behind, pushing that potential. And you went through everything that nanotech was good for, which is pretty much everything in 2005. Just say a couple words about that, if you would. Once again, feeding back to this innovation topic, but at the same time, if you could say anything about what's happening now, because obviously the hot topic nowadays is everywhere is artificial intelligence. And like in this report that you wrote, obviously, whether we're talking about drug delivery and food processing or this, that, the other thing, AI has a role somewhere, everyone says. Say a couple words about where you think these new tools are going, specifically in terms of improving the global equity equation.
Yeah, firstly, the AI debate reminds me of the live donor liver transplant ethical debate on steroids. It's something that could affect the life of every single human person. There's been a recent call for a pause, which has echoes of Asilomar. Same thing happened with the biotechnology early on in the early parts of biotechnology. Obviously, you've got the question of nefarious uses. So there's a whole kind of coming to grips with the technology itself. I'm going to take that question though in a slightly different direction, which is this. What happened in COVID was that our social fabric was torn. A lot of things happened, and there's a lot of lessons to be learned. And I like to say that the top 3 lessons of COVID were equity, equity, and equity, which, by the way, is another point about CSOs. When you look at how they advocated around intellectual property, around access to drugs, some of the same people that were making those arguments for HIV antiretroviral drugs in 2003 were unfortunately having to make the same arguments on COVID vaccine and COVID vaccine equity in 2021. But in any event, one of the most fundamental things that happened, and I think one of the almost hangovers of COVID, was the tear in our social fabric, the political polarization, the actual, there's a difference in the United States in mortality rates from COVID between red states and blue states. I wrote early in the pandemic that the most effective vaccine is leadership. And we've come through that pandemic more polarized than ever. It's not just misinformation, it's fundamentally trust, which is, by the way, the thing that best predicts outcomes of the pandemic. It's wild. It's actually trust that best predicts. Trust in ourselves, trust in government. Anyway, there's a mend in the social, there's a tear in the social fabric. And to some extent, that's been exacerbated by technologies like social media. And that's where the AI link reminded me to say that. And one of the things we need to do now is mend that tear. So we need to ask ourselves, how can we listen better to each other, understand each other's perspectives better? Because a country that has higher levels of trust and higher levels of let's say, just higher levels of social trust will do better in the next pandemic. And there is certainly another pandemic coming, and we have to think hard about how social media, including AI, would affect that very, very fundamental issue in trust. And of course, in the AI thing, it's things like AI generated images that are fake, AI generated videos that are fake, misinformation. AI loves to spew out very great explanations with references that are fake. Right. And so those things get very much into the heart of this trust question. So for me, it's less a question of the technology, more a question of the impact on trust, because I saw how erosion of trust leads to worse outcomes in COVID, and that then leads to the question of how we get ourselves prepared better by enhancing trust and listening to each other better.
Wonderful. Appreciate you sharing that. Peter, so we just celebrated 75th anniversary WHO. I've been honored here to have great guests, Maria Van Kerkhove and Rosamund Lewis and Dr. Gedehun, Anna Laura Ross, per sort of the innovation side of things, all doing amazing projects. You obviously, as I mentioned in the bio, you're responsible for the $1 billion target, the strategy there. Where are we going? Obviously, 2048 is 25 years down the road. We got a lot, as you were mentioning. There's certain things that are moving, certain things that are lagging still. What do you want to see for the coming years? And, what does 2048 look like to you in the position of strategy and innovation that you sit in at WHO?
Yeah, I would like to see what I would like to see by 2048, 25 years from now, on WHO's 100th anniversary, is a WHO that continues to focus on measurable impact in countries. That was really what was behind the $1 billion targets, and one that really focuses hard on the question: how do we accelerate that measurable impact? How do we speed up the $1 billion targets? How do we speed up the Sustainable Development Goals? As far as I can tell, there's really only three ways to do that. One is innovation in health products, in services, in finances. We talked about that. Another is data and delivery, where you're really, like what Nepal did recently, focused on, okay, here's our top 5 priorities: maternal mortality, health preparedness, et cetera. Here's where we're at now on them in terms of the metrics. Here's what are the key barriers. Here's how we overcome them. And on a regular basis, tracking progress. That kind of very disciplined data and delivery focus. And obviously, that it requires building up data systems at the national level. One of the things I learned, by the way, in developing the strategy with Dr. Tedros is everybody loves to talk about targets, but countries love to talk about data systems. And they're right, because without the data in country, the targets are meaningless. Anyway, the second one is data and delivery. The third one is partnerships. Whether those are among multilateral agencies like WHO and UNICEF and World Bank, et cetera, whether they're with civil society, and you see we talked about that a little bit earlier. You see the WHO Youth Council, WHO Civil Society Commission. The question is how to channel that into progress. Yep. And then, or whether it's with the private sector and how to work with the private sector, because that's where a lot of the advances are. So innovation, data and delivery partnerships, those are the three ways to speed things up. What I'd love to see by 2048 is WHO really supporting countries even more to accelerate progress on those targets. And I'd like to see one more thing, because the quintessence of WHO is it is the last line of defense for the poorest and most vulnerable people in the world. And so I'd love to see that continue and enhanced, whether you're talking about gender equality, whether you're talking about LGBTQ rights, whether you're talking about racism in medicine, whether you're talking about some of those social determinants like poverty. WHO is the last line of defense for the most vulnerable people. And it's most obvious in humanitarian circumstances. Even in the last couple of weeks, Tedros's interventions, his statements around Sudan, health facilities not a target, access to health facilities. Humanitarian situations are really, and situations of conflict where the most vulnerable people in the world are. And that's actually where we lose a lot of the sustainable development goals as well. So 2048, I'd love to see a WHO more committed to supporting countries, just as committed to supporting countries on measurable impact, but with really evolved and even more practical ways to help them speed up progress. And then secondly, the ongoing focus on the poorest and most vulnerable people in the world, because at the heart of it, that's what WHO, that's what the United Nations is actually about, and that's also at the heart of the Sustainable Development Goals. Excellent. The other point is you can't get to the 75th. I always realize that when you look forward, you also have to look backward. And just to say very quickly, WHO is an essential organization for the world. We saw that in COVID. Imagine what it would be like, what the world would be like without that mechanism to, for example, just take one example, pre-authorized vaccines, or the type of guidance that we were hearing from WHO. And when you think about the types of things that it's done, for example, the eradication of smallpox, smallpox killed at least 300 million people in the last century. If you take every penny that everybody has ever invested into WHO, that single thing makes it worthwhile. Oh, yeah. The fact that you had 300 to 500 million people die in the last century and 0 people are dying of smallpox in this century, that single thing is worth every penny that was invested into WHO. So the 75th is both the time to look forward to 2048, and you're a very forward-looking person. It's both, and it's also a time to pause and to celebrate some of the accomplishments, be it smallpox, be it primary health care in Alma Ata in 1978, be it Framework Convention on Tobacco Control and the reduction in smoking over the past 20 years. All kinds of examples to celebrate.
Really outstanding. Yeah, no, it's an amazing history, and you're forward thinking, and sort of the next chapter of it all is just equally exciting, and it's going to be fun to continue to watch and see how everything evolves, not just on the grand challenges front, but obviously in WHO's role. Peter, what else is coming up for you specifically in 2023? I noticed that a couple of weeks ago you were at a conference on Consortium of Universities for Global Health. What else is coming up that we should know about in terms of talks that you're going to be giving, conferences, places that we can listen to you, meet you possibly? Anything else that you want to you mention, please have the floor.
Yeah, thank you. I'd love it if I could get in touch with your listeners and viewers through my blog. I'm writing every couple of weeks about some of these ideas at singerp.substack.com. You please go there and subscribe for free, and that's a great way that we can stay in touch. And so that's a good channel, Ira. But I want to use your question to actually bring it back, not to me, but to young people, because we just talked about the Sustainable Development Goals and kind of big global institutions like the World Health Organization. But at the end of the day, what gives me optimism is young people. So what I've really focused on in my blog is kind of career advice to young people. And my top career advice, and this is actually an echo, this is the personal version of the grand challenges thing, is find a problem and solve it. Everybody can find a problem and solve it. For me, the initial problem I encountered was when I was an intern. I was caring for a woman with metastatic cervical cancer, and she was going to die. It was very sad. She was in her mid-30s. And I realized that I could rattle off 20 causes of why the phosphorus in her blood was low. But when it came to when her heart stopped and whether we would resuscitate her, we had no real approach to that was systematic. And so that caused me to take that problem of poor quality end of life care and work on it for 10 years and do some things to try and solve it. So I would really encourage everybody listening, and especially young people, but also not so young people, to just ask yourself, what is it that really bothers you the most around your own experience, and to do something to fix it. And so, for example, one of my blogs is about find a problem and solve it. Second bit of advice for young people is get the right mentors working for you. So quite difficult for people to answer the question, what do you want to be in 10 years? Easier for them to answer the question, name 3 people who are doing stuff like what you want to be doing 10 years from now. So I encourage everybody to do that homework, find those 3 people, reach out to them and ask them for career advice. And two times out of 3, you'll be able to turn them into your mentors. And this is also an issue in equity, Ira, because often mentorship is used kind of old boys club, if you will, to erode equity, unpaid internships, old boys club. But we can all help anyone who reaches out to us. And I certainly do in this way, by helping them identify people, helping them connect with those people, to promote equity, especially if we are very lean in to a pro-equity position and are particularly focused on doing that with people who maybe haven't had the same advantage as other people. So find a problem and solve it, get the right mentors working for you, and leverage your platform and hop aboard a rocket ship. And I already talked about my rocket ship example, which was the Gates Grand Challenges in Global Health, leading to Grand Challenges Canada and other things after that. But I would just encourage people to take whatever platform you have and leverage it, but also stay very attuned to rocket ships that are passing by that you can jump onto and take advantage of. So, I kind of turned a question about what am I doing next into a question about what are young people around the world doing next and how can we all best support them? Because that is, and this is what the fundamental interest in your podcast is about, that's actually the way to create a better future, because the SDGs are only as good as the people solving them. So, if you have a vision of tens of thousands, hundreds of thousands, millions of young people around the world, identifying the problems in their own locale and solving them, getting the right mentors, leveraging their platforms, but finding problems and solving them, that's the way to make the world a better place. And by the way, my advice to young people is think about your career like that. Don't think about your career. Think about your career as a series of increasingly important problems that you solve. I had great advice once from mentor John Evans, who said, it doesn't matter what it says on the outside of your tombstone, by which he meant titles, etc. Sure. What matters is what it says on the inside of your tombstone, by which he meant the problems you've solved, the people you've helped, the contributions you've made. So that's where I'm going to put my focus, Ira, is on young people, on supporting them, and on helping them to find a problem and solve it, because that's really the best way, I think, to help create a better world.
No, that's an awesome message, and we will link, if everyone listening and watching, we will link to Peter's Substack in the bio of the show. And Peter, I'll tell you right away, because I have 3 kids that live in this house with me here. And I make them all watch the show. So there's three here in Philadelphia area that will get your message right away. No, really, really awesome stuff. I just really wish you the best with all this. It's just an amazing, again, journey that you've been on, and I really appreciate you sharing it with us, and of course the next generation that's going to be listening. So definitely thank you for that. Again, for everybody that is going to be listening to this particular episode of the show across the various podcast networks or watching on the YouTube channel. Again, you've been listening to Dr. Peter Singer, Special Advisor to the Director General, World Health Organization. Pick up a copy of his book, The Grandest Challenge, Taking Life-Saving Science from Lab to Village. Peter, again, I want to thank you for taking time out of your schedule to come talk to us and educate us on everything you've been doing. Obviously, thank you for doing it. And as we like to say, as you said on our show, thanks for helping to create a better tomorrow for so many people out there via what you've been up to. Really, really great story.
Thank you, Ira, and thanks for everything that you do. And it's been great to spend this time with your listeners and viewers.
Great having you.